Hi, I'm Gail from Aged Care Explained. Welcome to my Aged Care Mythbuster series. Today we're busting aged care myth number 20, and it's that I don't need to downsize or right size because there's plenty of time. I'm fine. Well, maybe or maybe not. Things can change just like that. And generally it will be a stroke, a broken bone, a heart attack, or even rapid onset dementia that can cause the change. We know a lady whose dad got up during the night to go to the loo, tripped over the dog, fell and broke his leg in 3 places, had to have a couple of operations, and within a week absolutely everything had changed. Fortunately for this family, he'd sorted out his will and power of attorney and advanced care directive a number of months before, so that was fantastic because everything was in place so that his care and his care needs and what he wanted was all documented, so they knew the type of care to provide for their dad, which was great. So quite often people don't see the need for their, for the downsizing or right sizing or decluttering in their home. What they don't realise is that every time they move some things on, it actually improves the mental feng shui. It has a clearing effect in your mind. It can actually raise your spirits. For people who've got depression, if they can start to work through this process of moving things on at a sensible rate, and while they still have a choice, it really is like a mental cleansing. Lots of families describe this. I know some professional decluttering experts, and they talk about the mental feng shui. It's really, really important. So it can be helpful. They also suggest that you don't look at your house and go, oh, how am I going to deal with this? Just look at one drawer at a time. And all of us can manage to do one drawer at a time. If you just gradually work your way through, work out what you really do need to keep from that drawer and what might have sentimental attachment, and you can actually make the process achievable. It's like they say, don't try and eat the whole elephant at once. Just start on the little toe. And if you're looking at an elephant and eating the little toe, that is probably achievable. So start on one drawer at a time, and that will be really good. The other thing is, if you're doing it, if you're the older person and you're doing it, and you're making the decisions about what stays and what goes, you actually get a choice rather than somebody else just doing the whole thing for you later. One of my aunties, Mum and I used to go and have lunch with her from time to time, and we were there one day and Auntie Nell said, I'm starting to declutter. I don't do as much entertaining as I did, so I'm going through all the cupboards and deciding what I need to keep and what I don't need to keep. And she showed me 2 cut crystal bowls and asked if I would like one. I took the one I liked best, and every time I use it I think of her. She had the pleasure of seeing other people using things that they actually wanted of hers. So that was a really good thing to uplift her spirits too. So think about the decluttering. If you really can't face it, I can help you to find good, sensitive professional declutterers who can actually help you with the process, or if it's just simply too overwhelming, they can do the whole thing for you. So Aged Care Explained, contact me and I can help with that. Please stay tuned and we'll bust aged care myth number 21 very shortly.